Hey, I'm Dr. Andy. What we're doing today is we are introducing Graston therapy for upper back pain. Obviously, it's one of the biggest complaints that we get for teachers and for desk workers because of their posture and their ergonomics at work, and they carry tons of stress and tension through the upper back into the shoulders. So that's what we're going to do here today. Your muscle fibers are designed to look like neat, thin rows and bands, like as if you took a bunch of rope and laid it nice and neatly next to each other in long rows. What we do is we take some of this emollient, which allows the tool to roll over the skin without scraping too much. When we get injured, rather than those nice rows of muscle fibers, we end up with a gnarled mess of fibers. Picture your earphones and you put them in your pocket and you walk around all day, and when you take them out at the end of the night, it's just this garbled mess. That's what your muscle fibers actually end up looking like. So in order to help them heal properly, we actually have to break those muscle fibers apart again. After the Graston, he'll do some stretching and those fibers will heal smooth again. So all we do is we take our tool and we start to slowly go over the muscle, and everything should feel nice and smooth. And at certain points, I'm going to find some areas where it doesn't feel smooth anymore. It feels like I'm going over a bunch of tiny little bumps underneath the surface. Those are the actual muscle adhesions, the actual parts where those muscle fibers are all ripped apart and kind of healed in this nasty mess. And it's going to feel differently because it's not nice and smooth and linear. So we get into those spots and we start to, almost like a massage, work them out. We take the tool and we literally dig in there. And it's really not uncomfortable. Mitch, is it uncomfortable? Good. He said no, just in case you couldn't hear. We get about 80% improvement after the first visit. We usually have to do a couple after that just to knock out the final 20% so we can get you back to 100%. But this is actually really effective for people that have nagging upper back pain, especially in between those shoulders where it's really coming from muscle tension. Thank you guys very much. If you have any questions, any comments, leave them below, tag a friend, and just remember to live with passion, not pain.